Hello everyone. The topic for today is theories of dental caries. These are the contents: introduction, classification of dental caries, etiology, theories of dental caries, and reference. Introduction: dental caries. It is an irreversible microbial disease of the calcified tissues of the teeth characterized by demineralization of the inorganic part and destruction of the organic substance of the tooth, which often leads to cavitation. The word caries is derived from the Latin word meaning rot or decay. The stages of tooth decay are decay in the enamel, advanced decay in the enamel, decay in the dentine, and decay in the pulp. The classification of dental caries. Based on the location of caries, it is classified as pit and fissure caries, smooth surface caries, and root surface caries. Based on the speed of caries progression, it is classified as rampant caries, chronic caries, and arrested caries. Based on the extent of caries, it is classified as incipient caries and cavitated caries. Based on G.V. Black's classification, which is based on treatment and restoration, Class 1 caries. Caries is seen on the pits and fissures of molars and premolars. Class 2 caries. Caries is seen on the proximal surfaces of molars and premolars. Class 3 caries. Caries is seen on the proximal surfaces of anterior teeth without the involvement of the incisal angle. Class 4 caries. Caries is seen on the proximal surfaces of anterior teeth with the involvement of the incisal angle. Class 5 caries. Caries is seen at the gingival third of the facial and lingual surfaces of anterior and posterior teeth. Class 6 caries. Caries is seen on the incisal edges of anterior teeth and cusp tips of posterior teeth. Etiology of dental caries. Primary factors: tooth, dental plaque, diet, time. Modifying factors: saliva, systemic health, sex, heredity, race, geographic environment, and occupation. Theories of dental caries. Early theories: the legend of the worm, endogenous theories, humoral theory and vital theory, exogenous theories, chemical acid theory, parasitic theory, acidogenic theory, proteolytic theory, and proteolytic chelation theory. The other theories are sulfatase theory, complexing and phosphorylating theory, Birch and Jackson hypothesis. The legend of the worm. According to an ancient Sumerian text, toothache was caused by a worm that drank the blood of the teeth and fed on the roots of the jaws. Humoral theory. The four humors that were thought to maintain the body health included blood, phlegm, black bile, and yellow bile. All diseases, including dental caries, were attributed to the imbalance between these factors. Vital theory. Tooth decay originated, like bone gangrene, from within the tooth itself. Chemical theory. Teeth are destroyed by inorganic acids formed in the oral cavity. Parasitic theory. The role of microorganisms in the process of dental decay was substantiated by Leeuwenhoek, who found animalcules from the scrapings of his teeth even after maintaining meticulous oral hygiene. But the mechanism as to why and how they caused the destruction of the tooth was not clear. The new theories of caries etiology are acidogenic theory, proteolytic theory, and proteolytic chelation theory. Acidogenic theory. It was proposed by Miller in 1890 and it is the most accepted theory. Dental decay is a chemicoparasitic process consisting of two stages: the decalcification of enamel, which results in its total destruction, the decalcification of dentine as a preliminary stage, followed by the dissolution of softened residue. The acid that affects the primary decalcification from the fermentation of starches and sugar lodged in the retaining centers of the teeth. Three important factors that influence the process of tooth destruction are the oral microorganisms in acid production and proteolysis, the carbohydrate substrate, the acid that causes dissolution of tooth minerals. The limitations of these theories were It did not explain the subsurface demineralization. It failed to justify rampant caries. Smooth surface caries is not accounted in this theory. Phenomenon of arrested caries is not explained. This is the pathophysiology of the theory. Proteolytic theory. It was proposed by Gottlieb in 1941. It states that the organic component of the enamel is broken down by the proteolytic enzymes, opening up pathways for the bacteria to attack the enamel by other processes such as acid or chelation. Caries is initiated slightly alkaline pH. Limitations of this theory were: in vitro studies didn't prove the proteolytic process of caries. Proteolytic bacteria are uncommon in oral cavity. It didn't explain about the role of sucrose, pH, and fluoride in dental caries. Protein content of enamel is 0.6%, so initiation of caries by proteolytic process is questionable. This is the pathophysiology of this theory. Coming to the proteolytic chelation theory, it was proposed by Schwartz in 1955. It states that two processes are involved in caries: proteolysis and chelation. The enamel is demineralized by chelating agents at neutral pH. Protein breakdown products and lactic acids are some chelating agents present in the nature. The limitations of this theory were: it fails to make a mention of sugar and acid production. Scientists prove that chelates are weak and cannot cause decalcification. Schwartz said that carbohydrates does not cause acid production, but it stimulates proteolysis, which is not true. This is the pathophysiology of this theory. Complexing and phosphorylating theory. According to this theory, the high bacterial utilization of phosphate in the plaque causes a local disturbance in the phosphate equilibrium in the plaque and tooth enamel, resulting in a loss of inorganic phosphate from the tooth enamel. Soluble calcium complexing compounds produced by bacteria cause further tooth disintegration. Saliva is an abundant source of inorganic phosphate for bacterial utilization. Hence, it is highly improbable that depletion of phosphate in the plaque by oral microbial metabolism results in phosphate withdrawal from the enamel. Birch and Jackson hypothesis. Jackson and Birch suggested that genes determine whether or not a site on the tooth is at risk. An abnormal mitotic control protein has been proposed that causes the distortion of the odontoblast as a random event that leads to changes in the resistance of the enamel to the acid attack. Thank you.